So the second governance law we looked at is how we budget. And we do something called we fund inputs, but we don't fund results in our budget. Now, what do we mean by inputs? Well, inputs mean we may list things we're going to throw money at, but we never actually tie them to here are the results we expect to see. And the reason that becomes such a problem is we don't then know, look, do we have a problem in how we're delivering the service, or do we have a funding problem? Case in point, let's say I hired you to cater an event. And I said, look, I would like everyone to have a lobster dinner. Here's $10 per person. Now you go out and make sure there's a huge feed of lobster and nobody has to be turned down if they want second helpings. I show up on the day and there's sandwiches. And I say, well, wait a minute. You know, I funded this program. In fact, I gave you 5% more than the last caterer I hired. Why are there only sandwiches? And the answer might be, well, at $10, you're just not going to get lobster. What I did is I funded an input. I said, here's how much I'm willing to spend, and I didn't tie it to the result I hope to achieve, because if I work back from the result, I might arrive at a different number. That's kind of what we do with budgeting in New Brunswick, is unfortunately we have a lot of departments who release plans saying, for instance, we're going to have 90% literacy, we're going to have reduce wait lists for seniors waiting for long-term care, we're going to have X number of families get a doctor. And people are probably feeling, well, why don't those numbers ever actually come true? Maybe it's because when those plans get approved, that actually doesn't impact how they're budgeted. The budgeting process doesn't tie funding to results. In fact, last year we did something interesting. We took a look at a few things where there was actually some good news in the budget and said, explain to us how you arrived at that number. Did you use any basis of results or any objective standard for how we do things? So for example, there was $1.7 million more for First Nations mental health programs. And when we said, well, cool, so how many people are waiting for mental health services in First Nations communities, and where would we hope to see that wait list down to with the 1.7 million? The answer was, well, we're counting on adding a number of services. But they didn't know how many people were waiting, and they didn't know what they hoped to achieve. There was a huge tax credit or tax reduction for landlords building housing spaces. And we said, okay, so if this is effective, how many new housing spaces would we need, or what other ways of measuring effectiveness do you have? They said, well, we intend to monitor it and see if anything gets better. But there were no metrics for whether or not it would get better. We have pilot programs. Case in point, there was a midwives clinic set up in Fredericton a number of years ago, and it was funded at a significant cost. So when we said, now, obviously, if it's a pilot project, that means you might roll it out if it works. What are you measuring? What would working look like? What are you hoping? Would it reduce costs in other areas? Would it reduce demand on doctors at the hospital? Would we have better maternal health outcomes? Would we have lower issues of complications in birth? What are you measuring? Like most pilot projects, we don't know. There was a $10 million increase for additional mentors and others in the education system. So we said, how many compositionally challenging classes are there? What is the proper number or proper classroom composition you're trying to achieve? How will we measure and know this is working? How do we know it's enough? They didn't even know at the Department of Finance how many classes had a classroom composition problem or how many children needed behavior mentors, but we funded more. This is what we mean by funding inputs and not results. We fund ribbon cuttings or announcements. It covers the need for a politician to say, well, we've clearly done more. But this would be like hiring a plumber and saying, look, I need my sink to stop shooting water everywhere. And the plumber says, well, you should give me $5,000. That is 10% more than my last job, and I'll be able to fund a dynamic new program with 2 new plumbing interns and increase the number of hours by 6% over my last job. And that'll stop the leak? I have no idea. That's how we budget in New Brunswick. And often we there have gotten very used to, on some very critical programs, funding knowing the budget isn't realistic at all. Case in point, child protection in last year's budget. Actually, they always give how much we spent last year and how much we're budgeting for this year. The number went down, and we asked, how is that possible when we've got a new Child Protection Act and you're adding services? The answer was really interesting. What they said is, oh, well, last year we had a lot more cases and more complex cases than we planned. And so we just added money at the end of the year through something called a special warrant. That's when government goes over budget and says, okay, here's the extra money to cover it. And they said, don't worry, if the same thing happens next year, we'll just issue another warrant. Well, is there any reason to think the caseload will go down? No, we didn't ask that question. Well, not only does that a weird way to budget, there's no worse way to plan a service. After all, if the Deputy Minister of Social Development knows he has enough money to meet the demand, he might be able to be more innovative in how he delivers the program. If all we're going to say is, look, it's probably not enough, but just pretend it is for 11 months and then we'll bail you out in month 12, we're just lurching from crisis to crisis. At no time are we budgeting based on results. So when departments in the social side say, here's how we're going to improve things, there's no connection. It's simply, here's what we did last year and here's how much more we think we're going to spend. So what we've said is, look, there needs to be some kind of organization at the center of government. A number of years ago, government merged the Executive Council Office, which is supposed to know social policy, with the Department of Finance and Treasury Board. So all that's happening now is nobody's even figuring out what needs to be accomplished on the social side. It's all run through the Department of Finance. The result is a budget that may make announceables of activities and inputs, but we're not actually seeing if any of it works. Once again, we're spending $7 billion on social programs with no concept of what results we're expecting to get. And that's the second governance flaw in New Brunswick.